how to complete the Network Adequacy template. Issuers seeking to offer qualified health plans, or QHPs, including standalone dental plans, or SADPs, on the federally facilitated exchange must submit a completed QHP application per CMS guidelines. As part of the QHP certification process, issuers are asked to fill out several templates with issuer and plan level data. These templates, along with any supporting documentation submitted, comprise an issuer's QHP application. Among these templates is the Network Adequacy template. Network adequacy refers to an issuer's ability to maintain a network with a sufficient number and geographic distribution of providers, including providers that specialize in mental health and substance use disorder services, to assure that all services will be accessible to enrollees without unreasonable delay. The Network Adequacy template collects information about the number and geographic distribution of in-network providers and provider data for each network associated with an issuer's plans. To complete the Network Adequacy template, returning issuers are strongly encouraged to generate and download a pre-populated template from the Application Materials tab of the Marketplace Plan Management System, or MPMS module, within the Health Insurance Oversight System, or HIOS. This pre-populated template will import the previous year's Network Adequacy provider data into the upcoming year's Network Adequacy template and can be downloaded for issuers to complete. To download the blank Network Adequacy template and applicable instructions, visit the Network Adequacy webpage of the QHP certification website. This webpage contains more information about the Network Adequacy section of the QHP application, including tips and additional resources. Before filling out the Network Adequacy template, download and read the instructions from the Application Resources section. Once you're ready to complete the Network Adequacy template, download and open the template and enable macros. Returning issuers are strongly encouraged to download a pre-populated template containing Network Adequacy provider data from the previous plan year from the Application Materials tab of the MPMS module in HIOS, but may also download a blank template from the Application Resources section of the Network Adequacy webpage of the QHP certification website. The Network Adequacy template is comprised of several different tabs. Issuers are responsible for completing the Network Adequacy Provider tab to report information on their contracted providers. The specialty types, taxonomy codes guidance, taxonomy codes, and county names tabs contain reference materials to help issuers complete the template. If any errors should arise while issuers complete the template, they will be listed in the Red Errors tab on the far right of the template. All required fields are denoted with an asterisk. All FFE issuers, including issuers in states performing plan management functions and state-based exchanges on the federal platform, or SBEFPs, are required to submit network adequacy information by completing the Network Adequacy Provider tab of the Network Adequacy template. When filling out templates in the QHP application, start in the top left corner and fill out fields moving down and to the right until all required fields are completed. Now let's walk through filling out the Network Adequacy template with sample data. Before you begin, make sure you have the necessary plan and provider information to successfully complete this template. In the User Control tab, complete the information in the Issuer Information box located in the top left. Enter the 5-digit numeric ID that you received when registering in the Health Insurance Oversight System, or HIOS, into the Issuer ID data element. Then indicate whether you are an SADP-only issuer. In the Source System field, select the name of the system you will use to submit your QHP application from the drop-down menu. If you are a federally facilitated exchange issuer, select HIOS. If you are an issuer in a state performing plan management functions, or SBEFPs, select SURF. After selecting the correct source system, use the drop-down menu to select the state in which you are applying for QHP certification. Upon selecting a state, a prompt will display reminding returning issuers to download a pre-populated Network Adequacy template from the MPMS module. Please note that issuers in state-based exchanges will see an additional field asking whether they're an alternate ECP standard issuer upon selecting their state, and the Select ECPs and Facility ECPs tabs will display. Only issuers in state-based exchanges populate Essential Community Providers, or ECP, data within the Network Adequacy template. All other issuers in federally facilitated exchange states, including issuers in states performing plan management functions and SBEFPs, enter and submit ECP data within the MPMS module user interface. Next, import your completed network ID template as outlined under Step 1. Click the Import Network IDs button and select the completed network ID template you are using. This will automatically populate a drop-down menu of your network IDs in the Network IDs column of the Network Adequacy Provider tab. For more information regarding the Network ID template and how to complete it, please refer to the Network ID template instructional video located on the Network ID webpage of the QHP certification website. Once the Issuer Information section of the User Control tab is complete and the Network ID template has been imported, you can begin to enter remaining network adequacy data into the template. The specialty types, taxonomy codes guidance, taxonomy codes, and county names tabs contain information that may be useful when completing the network adequacy template. The Specialty Types tab provides reference information for the individual provider and facility specialty types that can be added into the template. The Taxonomy Codes Guidance tab provides instructional information for correctly filling out the specialty type of individual providers and facilities. The Taxonomy Codes tab contains the taxonomy codes that crosswalk to individual provider and facility specialty types listed within the Specialty Types tab, serving as a reference for issuers when selecting the appropriate specialty types for their in-network providers. It also provides information on which taxonomy codes crosswalk into each time and distance specialty type. The County Names tab contains the county names and Federal Information Processing Standard, or FIPS, codes used in each state. Now let's walk through completing the Network Adequacy Provider tab of the Network Adequacy template. The Network Adequacy Provider tab should be used to report information on all providers in your networks that map to the provider specialty types displayed on the Specialty Types Reference tab. The Network Adequacy Provider tab consists of several data elements. Required data elements are denoted with a red asterisk. Complete each data element beginning with the active 10-digit NPI for the individual provider. If you do not know the NPI for a provider, please contact the provider directly, as CMS does not accept dummy entries for the NPI field. Dual issuers offering both medical QHPs and SADPs must enter both QHP and SADP provider data within the same network adequacy template. Note that the Network Adequacy Provider tab should contain all providers in your network that crosswalk to at least one taxonomy code referenced in the Taxonomy Codes tab, even those outside the immediate geographic area that still meet time and distance requirements for the respective county type designation. These providers must meet the following requirements: being appropriately licensed, accredited, or certified to practice in their state as applicable, offering in-person services at a brick-and-mortar location, and not known to be at risk for potential contract termination for the upcoming plan year. Issuers must submit valid and active NPIs. If an NPI is not found in the National Plan and Provider Enumeration System, or NPES, or is found in the HHS Office of the Inspector General (OIG) exclusion list, the issuer must remove the NPI from their network adequacy template, as it will generate a validation error. Next, complete column B and C by entering the provider's first and last name if entering an individual provider, or complete column D by entering the facility name if entering a facility provider. An individual practitioner's name should not be entered into the provider first name field, the provider last name field, or the facility name field for a facility provider specialty type. Instead, an individual practitioner's name should be entered into only the provider first name field and the provider last name field for individual provider specialty types. Similarly, a provider facility's name should not be entered into the provider first name field, the provider last name field, or the facility name field for individual provider specialty types. Instead, a provider's facility name should be entered into only the facility name field for facility provider specialty types. However, when a facility, such as a hospital, with whom the issuer is contracted, directly employs a physical therapist, occupational therapist, speech therapist, and/or an emergency medicine physician, and the practitioner is available to provide services at the facility to enrollees at an in-network cost, The issuer should list the provider facility with whom it is contracted in the facility name field for these 4 specific individual provider specialty types when the issuer is unable to contract directly with the individual practitioner. Next, use the drop-down in the provider grouping column to select the provider grouping for the entered provider. Then use the drop-down in the specialty type column to select all applicable specialty types offered at the identified provider location. If the issuer is contracted with an individual practitioner who is actively practicing multiple compatible specialty types at the same address at least 1 day each week, the issuer should select all applicable specialties for the same record and ensure that the specialty types selected are in compliance with the NA Provider Classification and Specialty Framework and the NA Physician Specialty and Subspecialty Compatibility Matrices that are available on the Network Adequacy webpage of the QHP certification website. You may use the Specialty Types tab to copy and paste applicable specialty types for your providers, but be sure to copy them exactly as they appear on the Specialty Types tab and ensure they align with the provider grouping selected. If the specialty type is not listed in the Specialty Types tab, do not list the provider. Do not include provider specialties except those the provider is actively practicing. Next, indicate whether this individual provider offers telehealth. This includes professional consultations, office visits, and office psychiatry services that may be provided through brief communication technology-based services, remote evaluations of pre-recorded patient information, and interprofessional internet consultations. If you have reached out to the provider and are awaiting a response, select Requested Information from Provider and awaiting their response. Next, complete the location information of the provider in columns H through M. If the provider has multiple locations, enter each street address in a separate row, but do not enter more than 10 locations for a single provider, with the exception of the following specialties that may sometimes reasonably exceed 10 unique addresses for a single NPI: emergency medicine, physical therapy, occupational therapy, speech therapy, and urgent care. Do not enter a PO box in the address field, as these entries cannot be geocoded for time and distance analysis and will return a validation error. Also, do not use this field to indicate that a provider is virtual only or telehealth only, as such providers should not be included in your NA template. Next, enter the appointment scheduling provider phone number. This field will assist in compiling the appointment wait time provider population file, or PPF, to support secret shopper survey activities. Finally, complete the Network IDs column by entering the applicable network IDs for each provider as assigned in the Network ID template. Issuers that offer both medical QHPs and SADPs, that is, dual issuers, must create separate network IDs for their medical and dental plans. However, they must enter their provider data into the same NA template. Once you have completed the Network Adequacy Provider tab, return to the User Control tab to validate and finalize the template. Now let's validate and finalize the template. Once you have completed the template, click the Validate button in the bottom left corner of the User Control tab. Any data issues in your template that need to be resolved will be displayed in the Red Errors tab. Correct these and click the Validate button again. Continue this process until all errors have been resolved. The Validation Status box to the right of the Validate button keeps track of the number of errors that remain before the template can be validated. Once the template is valid, click the Create Documents button. This creates an XML file that will be automatically saved in the same folder as the template. The XML extract is the file you will submit as part of your QHP application. Additional validation checks are run on network adequacy data within the Plan Validation workspace in the MPMS module. For a complete list of the network adequacy validations, reference the MPMS validations list found on the Data Validation webpage of the QHP certification website. If you have questions regarding your QHP application, please contact the Marketplace Service Desk at cms_feps at cms.hhs.gov or 855-CMS-1515. For more information about the QHP certification process, visit www.qhpcertification.cms.gov.